Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. To start with inferior mesenteric artery, we must know that it is the artery of hindgut. Hindgut includes the left 1/3 of transverse colon, descending colon, sigmoid colon, rectum, and upper part of anal canal above the walls. There, the left part of the transverse colon, the descending colon, the sigmoid colon, and then the rectum and upper part of the anal canal up to the valves. This whole constitute the hindgut. To go with the course of inferior mesenteric artery, this one is the inferior mesenteric artery that arises from the abdominal aorta at the level of L3 anteriorly and above about 3 to 4 centimeter above the bifurcation of aorta, abdominal aorta. It moves downward towards the left and give the branches. Main branches are 3: the left colic branch, sigmoidal branches, and the superior rectal branch. Left colic branch, sigmoidal branches, and superior rectal branch, which is the terminal branch of inferior mesenteric artery. The left colic artery moves downward toward the left and ascends, gives 2 branches, divides into ascending and descending branch. Ascending branch anastomose with the middle colic artery, and the descending branch anastomose with the sigmoidal artery upper branch. The sigmoidal arteries are many in number: upper, middle, inferior. Upper part of the sigmoidal artery anastomose with the descending branch of left colic artery, and then the lower splice the sigmoid colon, and it traverses the sigmoid mesocolon. Sigmoid mesocolon means the peritoneum fold that contain the sigmoid arteries. The superior rectal branch is the terminal branch. It anastomose with the left colic artery and form the marginal artery. This all is the marginal artery of Drummond. Marginal artery is formed by the left colic anastomosis, sigmoidal artery anastomosis, and superior rectal artery anastomosis. The superior rectal artery is the continuation of inferior mesenteric artery beyond the root of sigmoid mesocolon. sigmoid mesocolon के अंदर तो sigmoid artery है, वहाँ से जहाँ पे ये ख़त्म होगी sigmoid mesocolon, जहाँ पे ख़त्म होगी वहाँ से जो हमारे पास टर्मिनल ब्रांच आ रही है वो हमारे पास है superior rectal artery, and the level of it is sacral vertebra number 3, where it divides into further branches and forms a loop around the anus, not rectum. These branches which it gives at the level of S3 will communicate with the inferior and middle rectal arteries of in the submucosa of the anal canal, which are the arteries from the inferior vena cava. The inferior mesenteric vein has the same follows the same course as the inferior mesenteric artery. It drains blood from superior rectum, sigmoid veins, and left colic veins, and then drains into the splenic vein. There, the inferior mesenteric vein draining into the splenic vein, and then splenic vein and superior mesenteric vein join to form the portal vein, which is the hepatic portal vein, which enters the liver and divides into the left and right branch. Left branch goes to the left lobe and right branch goes to the right lobe. We will continue with hepatic portal vein in the next video.